Frustration reaching a boiling point in the House as well. Democrat Anthony Weiner summed up the feelings of a number of his colleagues saying, quote, Snow, Stupak, Lieberman, who left these people in charge? It's time for the president to get his hands dirty. Some of us have compromised our compromised compromise. That's a quote. We need the president to stand up for the values our party shares. We must stop letting the tail wag the dog of this debate. The congressman joins us now. What leverage do you have, Congressman?
Well, we have a conference committee where the House and Senate have to merge our bills. And we still have, kind of the mother of all closing pitchers, and that is the President of the United States. If he gets off the sidelines and says, you know what, this public option has to be in, we need to take the House language, I think that we can win a few votes here. I mean, the problem is we can't keep saying that any bill at any cost. We have to start remembering why we got into this discussion to make sure we get the best bill possible.
But at the end of the day, would it be possible that Democrats would abandon any health care bill if the president and political leadership in the House and the Senate demand that Democrats fall in line to score the political victory of appearing to pass health reform at any cost?
Well, look, we can't let the perfect be the enemy of the good, but we have to make sure at least we get the good. I mean, look, I'm very critical of the way the public option was jettisoned in the Senate. I think having the Medicare buy-in was a good compromise. That got left aside. As you mentioned in your intro, a woman's right to choose is under assault here. But there are good things in the bill. Let's not make any mistake about it. 30 million additional Americans are going to be covered. Health insurance is going to have to treat their customers a little better. But we're reaching that tipping point for a lot of us that we're wondering if Howard Dean is right, that it might be better to go start fresh.
Here's something that's confused me a little bit in just watching this. There are all these things that have been desired. Public, you know the list better than I. Public option, et cetera, et cetera. Each time somebody says, no, we can't do that, the compromise is you don't do it. That doesn't strike me as compromise. That doesn't strike me as negotiation. That just strikes me as asking for things from your parents, being told no, and then saying, okay, I won't do that. What happened to the concept of negotiation where you say no, and then you counter by saying, well, okay, we'll give up the public option if you break up the insurance monopolies and give us choice. In other words, there are if you're negotiating in theory, you don't just give everything up. You also may ask for something conceptually in return, which I know you understand, but the rest of the system doesn't seem to reflect that mentality.
Well, you're exactly right. As you said in your introduction, I've already compromised my compromise, and I'm now here asking to be compromising again. Look, many of us believe that you've got to take on the health insurance companies head on with an expanded public plan like Medicare for more Americans. Okay, we didn't get that, so then the public option became the compromise. And then they said, no, we're going to expand Medicare to let more people buy in. Each time, so long as the principle was providing some competition, we said, okay, this is not really compromise for one important reason. Every Republican has said they want no bill. And too many of these Democrats that really are holding us hostage for their position. In the case of Senator Lieberman, he was the one that proposed the Medicare buy-in, and even he flipped. So we don't even know who we're negotiating against at this point, but it certainly doesn't seem to be anything more than pushing more of us off the boat with every vote.
But here's what strikes me. If you look at no action, at least some of the analysis of it, it's very expensive. So in other words, if you don't do anything, it's very expensive. At the end of the day, don't the Democrats have to vote for whatever comes down the line? And as a result, no matter how right you may be or how left you may be, and I say right in the sense of how appropriate your solutions may be, not in the political sense, and I'm not even saying whether you get it, you have no leverage. Because you can't vote no.
Well, we're kind of like a group holding ourselves hostage with a gun to our own head that says if you make one more move, we're going to shoot.
I know.
The fact is we have a fidelity to trying to improve this process and trying to make it work. The other side doesn't. They could care less. But here's what I will say. There is a tipping point here. And that is, 44 years ago when we passed Medicare, a lot of people said, don't worry, we're going to start with those 65 and over and then come back in a couple of years and expand that. We're 44 years later, and that incremental expansion hasn't happened. So we have to make sure this may be our only shot for quite some time to come. And if we don't get it right, if the American people don't say, okay, bravo, you did something good here, we may actually be doing more harm than good. That's why a lot of people like myself are weighing right now whether whether or not something is better than nothing.
But let's say you believe it will do more harm than good, and there are those who believe that because it, again, forces people into the insurance system without giving them more choices. You basically create insurance customers without creating a real competition. Would you vote no?
If the answer to that question is it does more harm than good, I would vote no. And there are a lot of people who are in that same place. Now, I don't think we're at that tipping point yet. We have a conference committee we have to go through. There's a lot of things in both bills that are very laudable. We're focusing on the pressure points here. Things that people haven't focused on are important. But that's the question we're asking. And I want to tell you something else. Every time they make a change to get one vote in the Senate, they lose a handful of votes in the House. This is a difficult eye of a needle that we're trying to thread here.
Yeah, all right. Listen, always a pleasure, Anthony.